Good morning, and welcome to day 3 of Osteoarthritis Breakfast Briefings on Sunday, November 8th. I'm your Breakfast Briefings host, Alan Gabowski, Professor of Medicine at Weill Cornell Medicine and attending rheumatologist at Hospital for Special Surgery in New York. This morning, we're highlighting abstract 1482 from John Carrino from my institution and his colleagues entitled Joint Safety with Tanezumab, an integrated analysis from randomized controlled phase 3 studies in patients with osteoarthritis. Now, Tanezumab is a monoclonal antibody directed against nerve growth factor. It is an agent with a new mechanism of action that has been investigated for a number of years to relieve pain in patients with osteoarthritis, primarily of the large joints and particularly the knee. Now, this study looked at placebo and 2 doses of Tanezumab over a 16-week period of time. The dosing for the second study was the same, but extended over 24 weeks. In the third study, patients received Tanezumab 2.5 milligrams, Tanezumab 5 milligrams, or nonsteroidals over 56 weeks. Researchers used adjudicated composite joint safety endpoints consisting of primary osteonecrosis, rapidly progressive osteoarthritis of type 1 and 2, and subchondral insufficiency fracture or pathologic fracture. These kinds of anatomical derangements of rapidly progressive osteoarthritis and fracture are the results of the typical kind of Charcot joint that one sees as a result of repeated mechanical use in an already damaged joint. And what they found was that the agent Tanezumab was quite effective in relieving pain and improving function in both the short term and long term in these populations of patients. All of these patients had moderate to severe osteoarthritis, and the proportion of patients with adjudicated composite endpoint were higher in the population of patients who took Tanezumab relative to placebo or nonsteroidals. So I think that this agent is going to offer us an interesting alternative mechanism of action that can be used in patients for whom surgery is not or not yet an option, and in whom nonsteroidals may be problematic because of comorbidities, and also in whom opioids or opiates might be contraindicated. We're all looking forward to new mechanisms of actions that can help us achieve greater efficacy without having to in any way derange other organ systems of the body.